on the air. Thank you so much. I am Mary Johnson. I'm going to be your facilitator this morning. Along with, we have Miss Laura McClellan, Becky, Edwards Walton. We have Nathalie McGarrath, who is our timekeeper. Winston Robinson is here, Steve Johnston, Shay Abdullah, Gary Young, and our musician, Mr. Thomas Moore. Yeah! Thank you so much. We always begin with a word of prayer. We do believe in prayer. And I believe Nathalie, oh no, it was Blanche. Where's Blanche? Okay, Blanche.
All right, let's go to our Heavenly Father, a word of prayer. Thank you, Lord. But we know you're good. We know that you're worthy to be praised, and we thank you for it. Heavenly Father, we just thank you because we know that it's Women's Month, and we're here as women, and also men are in the room too. But we just want to thank you for the things you have done for us. We want to give you the honor, the praise, and the glory. But without you, we could not do anything. And we also encourage everyone that's in this meeting to do it decent and in order, so that way we can learn from each and every person that's in this room. And we just thank you for it. So Father, in the name of Jesus, we continue to lift up you and to say that you're worthy to be praised in Jesus' holy name. Amen.
Amen. Do we have any first timers this morning? Anyone here for the first time? Okay, could you stand and introduce yourself?
I'm Cedric Thomas. I'm the Vice President.
Use the mic here on live.
All right, I'm Cedric Thomas. I'm Vice President, General Manager of WSOC TV, Telemundo Charlotte, and TV 64.
So much for being here. Any other first time? Your first time?
No. We have two black station general managers in Charlotte, and that is history.
It is.
Okay. I do want you to take a minute to silence your phones. Please take, this is called the moment of silence, when we silence our phones. Okay, before I introduce our speaker, thank you very much. And since we do have a first timer, I will review how we do things here. Okay, our speaker will provide her presentation, and then we'll take questions from the audience. And what you do, you just raise your hand, and we'll take you in the order that you raise your hand, okay? So that's what we do. You have 30 seconds to ask your question, and then she can answer. Usually it takes her like maybe a minute or two to answer your question, but she will answer your question. Okay, I also want to recognize our Congresswoman of the 12th Congressional District, Congresswoman Alma Adams. That's the way it is when you vote, so keep that name in mind, Alma Adams. And we also have Mr. Arthur Griffin. I saw him speak in. Okay, thank you, and congratulations on your win on the, I was going to say school board. I remember when he was on the school board. Okay, that's when I was working. Okay, so do we have anyone? Martha Alexander is here. She's a former North Carolina Congresswoman. Thank you. Legislator. I'm sorry, you might get those. Okay, I want to introduce our speaker for today, and Congresswoman Alma Adams is also going to talk along with her at some point. Okay. Of course, today we're talking about Black maternal health, and I know this is it's really an important topic that we need to talk about. Congresswoman has been doing a lot of work around this. Danette has been doing a lot of work around this, and we want to hear both of them. Danette Glass. I've known her practically all my life. We grew up across the street from each other. Okay, and I do want to say this before I introduce her. We talk about women being first. Her mother was a first because her mother was an elementary school principal here in Charlotte. She wasn't the first principal, but she was the first woman employee who was allowed to be pregnant and work. Because in Charlotte, you had to resign. If you became pregnant, you had to resign your job. You could not work while you were pregnant. Yeah, my mother had 4 children, and she had to resign 4 times. Okay? And hope to get another job. Okay, I know. I think it's crazy now, but it was reality. But the community rallied around her. They rallied around her and weren't going to have it. We're not going to have it. She was going to be able to work throughout her pregnancy, deliver Danette, and come back to work. So her mother was the first.
Was she pregnant with you?
Yeah.
Yes.
You were the first child.
You were the first. Okay. Danette is a senior strategist and managing principal of First Team America, LLC, and chair of the Center for Family and Community Wellness. With more than 3 decades of leadership in public health, coalition building, and community engagement, she is widely recognized as a fierce advocate, visionary strategist, and systems innovator, advancing equity and wellness for families and communities across the Southeast. A pioneer in experimental learning, Danette developed nationally recognized simulation experiences addressing maternal and infant mortality, childhood trauma, and family violence. Her innovative models have transformed professional training and academic enrichment across universities, health care systems, government agencies, school districts, and community organizations. She's a native of Charlotte, North Carolina, and she's also a Duke Blue Devil. All of you Blue Devils listening. And without further ado, I'm going to go ahead and let Danette get started. And I really don't think I need to introduce our congressman because she's been with us. She's one of our congresswomen. I'm sorry. So I'm going to let you all get started, okay?
Thank you so much, and it is so good to be here with you all. I am actually just really honored to be here for a number of reasons. Left for Duke after graduating from West Charlotte High School, West Charlotte Lions, and only came back for a couple of years in Charlotte. And so, of course, you know, my mother and father were here, but we moved our parents to Atlanta with us, and I was in Atlanta for 33 years. And that's where the passion for maternal health came from. So I'm going to share some things with you that we did primarily in Atlanta, but because I am a Charlottean, we wanted to see some of that work here in Charlotte, and especially because of you. Because you have been talking about a trailblazer for maternal health, and all of the things that you have supported that we were beneficiaries of. So this is really an honor. I am blessed, did not know that you were going to be here, but you're going to see your work on the screen. This is going to be, and you will get the chance to see firsthand of how Congresswoman Adams has helped us across the country. I moved back to Charlotte a couple of years ago, a year after my mom transitioned, and I know she's probably like, yeah, now you're gonna go back to Charlotte, right? But, so we primarily did it. So I'm gonna advance the slides. I am gonna talk a little fast because I do want you to see a presentation. We have a presentation that we have prepared, and we want you to be able to see that. And again, let me say this right quick. I knew Miss Stevenson. She was absolutely wonderful. And that's why I wanted my first slide to say special thanks for her. Her courageous nature. She was bold and courageous. And just the fact that her legacy is continuing through this forum is so important. And Mary, thank you again for considering me for this. Thank you so much. So she already shared with you that I'm Danette and I'm the managing principal. That picture at the very top was with the Georgia Department of Public Health, and I'm just going to share something brief about that. Dr. O'Neill was a commissioner then, and we were doing a lot of great things and making some things happen. And then there was a change of administrations. And then Georgia being one of the states, as I stated earlier about what Congresswoman Adams has done, when it comes to Black maternal mortality, we've always been at the bottom of the barrel. And my mom saw that there was a challenge, and we got a chance to meet with Judge Hatchett and with her son, and we talked about some of the challenges that we're experiencing. When Kira passed, and you all know the story about Kira Johnson and all of that, the picture at the bottom is with the interns that we have from Johnson C. Smith and UNCC. I'm in my 60s now, and I hope I can work until I'm in my 80s. But we have to bring our emerging leaders, those that are interested. So we have an internship that we do for public health, social work, and nursing. I want to salute my mom briefly. Mary, thank you for that introduction. My mother was a trailblazer, and that was just the beginning. But she did develop a lot of programs. She was national president of organizations. And so I would like to salute her for being here today. Now, for what we're here for today. The Center for Disease Control, and I'm glad that we recorded these statistics before they were removed from websites. But the Center for Disease Control stated that over 80% of the maternal deaths were preventable. And that was bothering us. Why were those deaths preventable? And then we have the near misses, that there are these near miss events, over 50,000 near misses in a year. So what we believe with the Center for Family and Community Wellness, that the crisis facing Black women's health is not a mystery. It is the predictable result of long-standing inequities, I can say that word here, so in healthcare, social conditions, and the stress of navigating systems that too often fail to protect and support us. And so today I will share with you briefly some stats, because we've got to do the research, and I am a research scientist, and I am published, we are published with work that we've done with Morehouse School of Medicine. But the March of Dimes report is something that we always look at. Hopefully one day we'll start publishing our own stats. We can have our own research, and that's something that we've been trying to do for about 12 years now. But the March of Dimes is doing a great job, and we are grateful to see what they're doing with preterm birth and perinatal stats, and also with maternal and infant mortality. Now, in the state of North Carolina, the trends in maternal mortality statistics, they have stopped collecting that data. I did a lot of research in North Carolina. The last data I believe that was collected was in 2013. I went to the website yesterday, and it said that by the General Assembly in 2015 began reviewing the dates and said that they would no longer do any more after that. No longer reports maternal mortality stats. So I know that today's about why are Black women dying. At the bottom, I did pull the table of the Black maternal deaths here in North Carolina. So the community is crying. Are we listening? Are we responding? Our Congresswoman is responding. We are recipients of what she's done. Lives have been saved. They call you Congresswoman, but you're also a lifesaver. Lives have been saved. So we hear the voice in the community, and we have to identify the pain. We have to identify the gaps. We have to identify the stats. We have to identify who the key agents are, and then we have to identify the barriers. Now, that's what we do, and I'm going to show you when we do those things, what happens. So, the Center for Family and Community Wellness, my mother and I started this, and I'll just share this briefly. She did not know, but the doctor gave her only a couple of years to live, and I did not tell her that. And she still lived 5 years past their expiration date. But I asked my mom, what would you like for your legacy to be? And she said, well, what do you want your legacy to be? And so we talked about the pain in the communities. And she had met Charles Johnson and about his thing. So we put together what is now known as a Center for Family and Community Wellness, and we operate in many states. We went across the country, the Southeast region, and asked people of all walks of life, in every human experience, what was the issue? As a result of that, we partnered with the Center for Black Women's Wellness in Atlanta, and they had the Atlanta Healthy Start Initiative, and I was a consultant for them. We brought on Morehouse School of Medicine, and we started lobbying on Capitol Hill for a national maternal mental health hotline. We produced one of the first studies on Black maternal mental health, and that's one of the published that we have. And so I want to thank you again for your work with getting that line established. We kept saying, because we knew that our women, our moms, were in pain, and they were having issues, and that was causing stress, and that stress was causing preeclampsia and preterm birth and low birth weight babies, and then we were having these infant mortality numbers, and this disparity was continuing to grow. But that was because we were listening to the community. So we heard the cry, and we published it, and now that study has been cited over 165 times in 2 scholarly journals. And now I'd like to share with you a presentation on respectful care in birth.
Addressing the issue of maternal mortality in the U.S. is mandatory and not optional. Black mothers are up to 4 times as likely to experience adverse pregnancy outcomes than white mothers. 65% of them reported some barriers to open discussion with their providers. And 19 to 21% of ethnic minority women reported poor treatment due to race, cultural group, or language.
Black women are dying at higher rates than white women in our society, particularly surrounding childbirth and childbearing. It has a lot to do with our standing in America and our access to health care. I think that is a major contributor to that. In addition, there have been several studies done that have looked at health outcomes in populations of African American women and compared to Caucasians and others. And it's really an interesting phenomenon because even women who are matched at the same educational level, we as African American women tend to still have poor outcomes.
Fact: 60% of pregnancy-related deaths are preventable.
80%.
My name is Christina Guillen, and I almost died during childbirth. So I came into the hospital with multiple birthing plans, and I was unheard. I had to fight for every piece of my birthing plan and what I wanted to have for my experience to happen. And everyone seemed to dismiss, demean, or degrade what it was I was trying to do. I was immediately pegged as being difficult, demanding, when in actuality what I wanted was the least intrusive type of birth possible. My labor, it definitely took a while. I stayed at about 4 centimeters for over 24 hours. I could feel my resolve starting to weaken, like maybe, this wasn't, the right option. Maybe I should have got the epidural. And within the hour, I started to feel like this ring of fire. Like I need to push. Like I felt this intense pressure, and it literally just felt like I was on fire. And so I called the nurse in, and I shared with her, hey, this is what's happening. I really feel like I need to push. I was like, can you please call my doctor? You hear her go, as she's putting on her glove. I mean, I really don't see, and I said I would prefer if I get the physician check so that way if I have progressed, because I feel the need to push. And so then there's this, and the pulling off the glove, it was an exaggeration of emotion, as if it was very obvious to myself and everyone in the room that I had annoyed this lady. She was not happy to be working with me as her patient. It was just that kind of energy in the space The doctor comes over and checks, oh my God, you're crowned. Okay, well, let's get ready to have a baby. And literally, I had a chance to rip the side of the bed and push. And I began pushing, and within 10 minutes, my daughter was there. My doctor literally walked in as she's sliding out. They're now trying to deliver the afterbirth, and you hear the doctor's feet splash. So, oh, there's a lot of blood here. And she started hearing like there's this conversation, and she's like, well, you know, we're gonna do a extra packing. We're gonna put some extra packing in there, and everything should be fine. And I get packed up, and in that rush to pack, apparently, some placenta wasn't removed, or maybe they didn't notice a hemorrhage. I'm not sure what happened. My best friend still is there with me, and the nurse is coming in to check on me, and she lays me back. And I said, you know, I just don't feel well. I said, and I start to literally feel life draining out of me. My best friend said I turned to her and said, please take care of my baby. Thank you for being here. And next thing you know, all the machines are going beep. And at this point, I'm gone. And they come rushing in with crash carts. They throw my friend out the room. My mother, backstory, is a pediatric nurse with over 30 years of experience. When I crashed, the doctor came in and ordered 3 times the dosage of a medicine that would have killed me. Had they pushed that dose, they were ready to push that dose. My mother yelled out, "That is the wrong dose. That's the wrong dose." He said, oh, okay, you know, thank you, nurse, thank you. I'm not a nurse here, I'm her mother. My mother saved my life, and I woke up 48 hours later in ICU. That was the experience I had. And what was, I think, most heartbreaking about the experience is that no one thought it warranted apology, follow-up, any type of consideration. It was a typical birthing experience for a Black woman in that hospital. And what I know for a fact, what I know in my heart, and to be honest with everyone in that room knows that I would not have walked away had it not been for the intervention of the women, of the caregivers that I had in my life who I actually brought to the scene.
Do your research, read reviews, and talk to friends and family before choosing a healthcare provider.
I think it's very important for people to be able to express their concerns to their healthcare provider. And healthcare providers don't always mean it's a physician. There are nurse practitioners and certified nurse midwives who also partner with physicians to see patients. And so, whomever your provider is, it's important that you feel comfortable explaining what your problem is.
Check online for hospital statistics and what birth options are available to you. You want to choose a facility where you know your voice will be heard.
And so I had my birthing plans already ready. I had different options available. And so for me, it was an opportunity to hopefully try to kind of get to know the staff who will be there when I actually brought my daughter there.
You have a right to informed consent and the right to have all the information concerning you or your baby's care. Racism and bias are real and can impact your health. If you experience discrimination or feel disrespected by providers, nurses, or healthcare staff, you have to address it. Remember, you have options.
And so I said it's important that we have a conversation around the state of color, because as a woman of color, I want to make sure that, you know, the things that have been plaguing a lot of women of color in birth won't take place.
This is what respectful care is. Care where you always feel like you're treated with dignity, empathy, and compassion, regardless of your race, ethnicity, gender, socioeconomic status, or reproductive history.
I would not have walked away had it not been for the intervention of the women, of the caregivers that I had in my life that was willing to go that extra mile to make sure that I was heard, I was important, I was respected, I was valued.
Build your village. Find a support system during pregnancy, birth, and beyond. Have an advocate that can speak on your behalf. Don't be afraid to ask for help. Raise your voice and speak up for yourself, because it's your body, your baby, your birth, and your choice, your life.
So this presentation is a part of our simulated experience. And so, as I mentioned earlier, we were so enamored with having it was just, we couldn't believe that in this century, post Jim Crow, that we would have these situations going on in America. It was heartbreaking. And so we did all of these interviews and focus groups and listening sessions and to hear the women. So I want to share with you some strategies of what we have put together and what we're doing in Charlotte. Mm-hmm. So respectful maternity care is a simulation that you talked about earlier that is happening all across the country. The Institute of Health Improvement provided funding for us to do it. We started with these universities in Atlanta, did that test, and now the UNC Charlotte College of Health and Human Services is allowing us to use their simulation lab. We'll be doing another simulation there in April. Around the same week, the Care Ring will be sponsoring their maternal health conference. We typically partner with them in that. If you're interested, I'm going to leave my card. Please let us know. There's no cost to you at all. No cost at all. And the simulation is an hour and a half, and you can go to our website. We've had over 40 immersions with providers, faculty, staff, and advocates and students across the country. And you'll see here all of the universities, UNC Chapel Hill, Novant Health, Atrium Health, universities all over the country have participated in that, and we would love for you to as well. You can go to our website, respectfulmaternitycare.org, and you can find out all of the information, and we'll be more than happy to get some information to you regarding that. Then we understood also, when Black women experience poor health outcomes, the issue is not biology. It is the intersection of stress, access, environment, systems that have yet to fully honor and protect the health and well-being of our Black women. That's the heart of the matter. And so with that in mind, we created HEART. And this was, again, listening to the community. This is an advocacy resource training, and it is out in Charlotte, a deliberate response to a critical issue. HEART stands for Health Education Advocacy Resources Training. And it was born out of a Healthy Start Initiative's desire in Georgia that had the worst rate in Georgia for preterm births and infant mortality and maternal mortality. And that was in Clayton County, Georgia. And so I work with a lot of HRSA projects, as we mentioned earlier, with Congresswoman Adams. And so we started the Clayton County Initiative in 22. We were applying for HRSA funding, but a private funder said, we're gonna fund it. And so we didn't even have to use private funding. And we were happy about that, to see the community embrace this. And so then it expanded to all over Georgia in 22. And in 23, we brought it to North Carolina, because I'm from Charlotte. And although I was in Atlanta for 33 years, this is still my home. And so we brought it to Charlotte. And then we established it in Colorado, and then moved into DC and Maryland area. These are all of the partners that were 23 and 25. And again, I want to salute Care Ring today. I want to salute the work of Care Ring. We have been partnering with them, and we are so grateful that we were able to support the work of Care Ring in receiving the Healthy Start funding. They have the Mecklenburg County funding and doing a phenomenal job, and we'll talk about that in just a minute. This is also offered to all residents of North Carolina, male and female in Mecklenburg County, regardless of the age, because we are advocates. Did you hear what she said in that video? If I hadn't had my advocate there, I may not have been here. Charles was advocating for Kira. He was advocating for her, but they still allowed her to die like that. So we knew, what could we do? What was the root cause of the disparity? Making sure that we're health literate and making sure that we have advocates. So that's how we can answer the question. So HEART matters because it developed directly from the community. It tackles urgent maternal and infant health challenges. It empowers families with knowledge and advocacy and navigation skills. And so the Heart in Action, again, you can go to our website, heartforalifetime.com, and you can register for that. We even provide a completion bonus when you finish. We have about 8 different sessions there. We recognize that patients with low health literacy can lead to mortality. We have to advance health literacy. We have to advance patient advocacy. Health literacy and patient advocacy is a critical strategy to disrupt disparities in maternal and perinatal outcomes. And so, we also, the National Institute of Health, National Heart, Blood, Lung Institute, we came together with Morehouse School of Medicine, and here in Mecklenburg County, I told you, I said I'm from Charlotte, North Carolina. We're going to make sure that these resources are coming here as well. And thank you again, Congresswoman Adams. But we also, with NIH, NHLBI, we're the regional community partner, so we were able to bring this preconception care to Charlotte, and we have Piedmont Health Services and Sickle Cell Agency, C.W. Williams Community Health Center, and By His Stripes Wellness Center. They are sites for preconception care, as well as, in the bottom picture, we have been blessed to have office space over in the Marcross area of South Park, and we have the strategy session. The top picture is with Dr. Gibbons, who was a former head of NHLBI, and we're just grateful for his leadership. So we talked about Caring. Caring has a nurse-family partnership. Caring has a guided journey with Mecklenburg County, the Healthy Start program, which we supported, and then they also have one of 2 generation clinics in the country. The other one is in Chicago. Charlotte has a jewel here because women weren't going in for their follow-up visits. So now when the baby goes in, the mom can go in too and get that checkup. Because a lot of times when we talk about the deaths occur postpartum. They're either hemorrhaging or there's some things that are happening. We also want to highlight University of North Carolina at Charlotte. They have the Charlotte Maternal Child Health Work Group, and we partner with them, and that's where we have our simulators there at that location. And you'll see Dr. Hopper and Dr. Dow and Dr. Deloche. So they're wonderful in that work. We also have the Weaving Institute with Dr. Janisha Brown here in Charlotte. So there's a number of resources here in this community, and there are others. We have the Doula Network. We have a lot of other networks that are going on. The community health workers. Several agencies have the maternal community health workers, perinatal health navigators to address this crisis. But now we're at our call to action. To change outcomes, we must change how we prepare, how we engage, how we respond. We have to invest in experiential learning. We have to strengthen health literacy, elevate patient advocacy, transform maternal care, and the time to act is now. When knowledge is shared, voices are empowered, systems respond, and maternal lives are saved. We've got to change the knowledge. We've got to change the response. We've got to change the outcome. And we have to be the change maternal health needs. The question is not what should change, but who will lead the change. And it has to be us. We are the change that we seek. I was working in juvenile justice. I saw the pain of those moms that I was dealing with. I moved over into public health because somebody had to address that issue. We can all do this work. I am a high school graduate from West Charlotte Senior High School. I went to Duke. I did. I didn't complete my studies there. I went to Cornell, and I did get certified in hotel administration. And I had a great career in the hotel industry. My last corporate job was in hotel investments. I told my mom and dad I wanted to go out and do some things in the community, and they said, God didn't tell you that. You gotta go talk to a psychologist, because I don't know. So let me tell you what I did. I went and talked to a psychologist, and while I was there, we put the business plan together for First Team America. So that's how First Team America came about. And he said, there's nothing wrong with you. I said, well, we're gonna have to spend this time in some kind of way. So that's how First Team America, we celebrated 35 years in December. And again, I am grateful for you all. Thank you so much. Honored to be here with you. Thank you, Mary.
Great. Okay, I would like for Congresswoman Adams to chime in here.
Well, first of all, let me thank you for the wonderful work that you're doing. Thank you for the support of our women. As you've heard, and I'm not going to repeat everything, but I'll tell you, I know Charles well. As a matter of fact, my bill in the omnibus package is the Kira Johnson Act. So I know her story. I know what happened, and we work. But let me just, first of all, thank you again for what you're doing. And to say that we started 7 years ago, the Black Maternal Health Caucus in the U.S. Congress. Congresswoman Lauren Underwood, who was the youngest black woman elected to Congress when I came from Illinois, had a good friend who, through postpartum problems, she had delivered her baby, went home, and after 5 or 6 days, she passed away. These are preventable deaths, as you've heard. 80%. Today, it's worse than it was 25 years ago. It was many years ago when I had my son, and I have 2 children, 4 grandchildren. But let me just tell you a little bit about how I got into this. Now, Lauren Underwood had her story that she was concerned about, and that's why we got together. Now, I'm probably 3 times her age. But even having that age gap, we were both very concerned about this issue. My daughter, who is actually 52 years old, I think, 52, maybe 53, something like that. She and her husband had 2 children. My youngest granddaughter, Jocelyn, their daughter, was a preemie. My daughter went in to have Jocelyn 20 years ago, and both of them almost died. What has happened and what we see, and I was just so moved by the woman that was talking about her experience and how she was ignored. That's the same thing that happened to Kira in the hospital. Her mother was there, her mother-in-law was there, her husband Charles, and he and I are really good friends, and we've done a lot of work together. But it was because of that situation with my child that I got very involved in this issue. We started the Black Maternal Caucus, Maternal Health Caucus 7 years ago, and a couple of years ago now, we have continued to introduce the Momnibus. And I just want to share with you the Black Maternal Health Momnibus Act. The maternal mortality rate in 2021 was 89% higher than the rate in 2018. So when we think about this is a really a critical problem. And people don't even know about it. So I'm happy about what you're doing and with your organization. And as a result of the Congressional Black Maternal Health Caucus, we now have one that the North Carolina General Assembly put together, and I'm happy that they copied that and that they're doing some work in that area. But we have 13 bills in that package. As I mentioned, the bill that I authored is the Kira Johnson Act to provide instances for people to at least understand what racial bias is. And of course, when you think about the medical folks, I really hated to hear this young woman tell that story, but she was very accurate. The nurse was annoyed. They simply sometimes get annoyed because of who they think you are. But let me just mention a couple of these bills. The social determinants of health is one of the bills which actually makes critical investments there. And when we talk about social determinants, we're talking about housing, transportation, nutrition. One of the things that bothers me a lot because of the destruction of the big ugly bill, I mean, some people call it beautiful, it's just gonna hurt a lot of beautiful people, nothing beautiful about that bill. But one of the things that they did do, they took $1 trillion out of that, out of Medicare. And so that means that a lot of the young women who actually receive their treatments and they go and get prenatal care are not going to be able to get it. So many of the things that we're doing today in the Congress that's happened with this really egregious bill that they brag about is really going to hurt a lot of people, including Black women. But also this bill, our package, will extend the WIC eligibility. And that's women, infants, and children. That's what WIC stands for. So into the postpartum and breastfeeding portion of your care. Also, we will provide funding for community-based organizations that are working to improve maternal health outcomes, and because we can bring some to your organization as well. Also, to help grow and diversify the perinatal workforce, and she mentioned something about that. Data collection. Now, it's interesting when people want to stop collecting data because we know we have a problem, but you really need to have the data to support that. Of course, if they want to stop that, then that means they don't want to talk to you about it. They don't want to do anything about it. But then the other thing I wanted to mention is the maternal mental health. That's a problem. Mental health is a big issue. It's one that we need to pay attention to because the conditions and the substance use disorders are part of that. But also we have a bill for incarcerated moms. One of the bills and 13 bills in the package is for incarcerated moms. We've had one bill to pass. President Biden signed it into law. That's women who serve. That bill it is now law. And so we're still working on the other 13. Also, the Black Maternal Health Omnibus Act would also promote innovative payment models to incentivize high-quality maternal care and non-clinical support. We have concerns, especially with all of the destruction and demise in our healthcare system and the funding that goes there. We're going to have a lot of people who are going to suffer. Let me mention two other things. Federal programs to address maternal and infant health risks. There's so many risks during public health emergencies. And then we're going to be investing in community-based initiatives to reduce levels of exposure to climate change. We can't leave those kinds of things out in terms of our environment and the risk for moms and for babies. And then finally, to promote maternal vaccinations. Now, we have a secretary who, I'm not sure what's going on with that guy. But the point is, vaccinations are very important for our babies, even as they are born and even as they are able to live and survive. Vaccinations become very important. Now, let me just end by saying this is a critical issue that has been overlooked, but I am so happy that so many people are becoming engaged in it now with organizations. Our moms can't wait. Our babies can't wait either. It's preventable, and if it's preventable, there's something we can do about it. And other than just talk about it. We can't just talk about the problem. We do a lot of that. We read about the problem, but we don't do much. Those are just individuals and people who are just concerned. Everybody's concerned about something. Hopefully, we're all concerned about this issue, but we've got to be committed. And so commitment goes beyond just being concerned. It's kind of like the chicken and the pig. The chicken who provided the eggs for the meal simply made a contribution, but the pig who provided the bacon and us gave his life, he made a commitment. And so we've got to make some sacrificial commitments to really not only understand this issue, but understand what we need to do about it. And this sister has already told you that. But thank you so much. And I get your emails. And I saw who was going to be here today, so I'm not here much during the week because I'm in Washington. But this was a Tuesday I was here, so I thought, and this was a great presentation. Thank you so much for sharing it, and thank you all very much. And thank you all for your support last week. I appreciate it.
Okay, that was awesome, both of you. Our first question is Ken, and then Winston, and Mason.
Danette, first of all, I want to say this is one of the best clearly outlined and presented programs ever. And to be an elder, it gives me tremendous pride and pleasure to see your career transition and the passion with which you pursue this transition. So thank you very much. My question is, this is not a women's only issue because we all know there was a male in the mix at some point.
Right.
So my question to you is, what do you find in terms of advocacy male partners participating and funding in your support?
You know, that is an absolutely wonderful question, and thank you so much. I have known Mr. Ken for a long time.
And don't you ever forget it.
That's what my dad used to always say, that is right. The beautiful thing that we are seeing now in research, and Congresswoman Adams just talked about data collection and how important that is. So the initiative that we have, the study that we're doing with Morehouse School of Medicine is on preconception care. And that is to bring the male partner and the woman partner together to make sure that both of them are healthy before conception. But a lot of times when things are challenging in a pregnancy, people always look at what's wrong with the woman, what happened with the woman. But sometimes it is paternal. And so we do see that. There also are a number of fatherhood programs here in Charlotte and across the country. There are Fathers Atlanta, Fathers Matter, Fathers Incorporated. There's a number of them. Kelly Little has a program here as well. And so they're bringing the dads together to work with them. And so we partner with several fatherhood organizations. We have invited many dads to come to the simulator so that they can advocate for the mom, as well as to be a part of the heart training so that they will be health literate regarding the urgent maternal warning signs. So that's what we've done. We have not targeted any funding. Our agency has not for the dads. Thank you.
Here, I think we need to mention that we need to keep our answers a little shorter because we don't have a lot of time left. I'm sure we have a lot of questions. And everybody knows, keep your questions to 30 seconds, please.
Okay.
2 minutes.
I had announced earlier that 30 seconds for the question and 2 minutes for the answer.
I think they need to remind.
Good morning. Your mother was my principal at Sedgwick Elementary School. And my earliest feeling of emancipation is around the time, I think, CMS of the state banned corporal punishment. Your mother used to keep a paddle in her office that kept us all straight at Sedgwick Elementary School. And I remember the announcement one day, and we would get paddled no more. And we played on the playground, as happy as we have been. But anyway, thank you so much for all the work you've done in this space. My question comes from the feeling of my youngest child is 3 years old, and I remember feeling just the conundrum of confusion between my wife, our doula, and our provider. And I just don't know what to do because 3 highly educated people are all just kind of going back to back. And in the other part, people were saying, listen to your doctor. How do you advocate for people you love or even yourself in situations where you're going against an expert?
You know, that is an excellent question. And you want to answer that one?
Well,
I think you have to tell the expert to go, you know where. Right? But really, in the case of the woman that you saw on the screen, in the case of Kira Johnson and all the women who we have actually interacted with, it's really going to take that outside person to speak up, because most of the time, these professionals, they don't know everything. And they don't have the compassion and the sensitivity for your wife that you would have, for your loved one that you would have. And so, you just have to make your presence known, and you have to be, if you have to, cut up, do that. But I think it's really important, and they will respect you for speaking up. Just like this woman's mother, who she happened to be a nurse, but she spoke up, and I think that's what you have to do. You got to disregard what they're saying, because they don't know everything. And they don't know how you feel. And they're not women either, most of them. And they're not having babies at that point. So, I would say disregard them, move on, and continue to advocate for the person that you're there to support. That is really important, because had her mom not stepped in, she would not be here. Had I not stepped in when my daughter was going through what she was going through, she wouldn't be here. My granddaughter would not be a rising junior at North Carolina A&T State University today. So I just think, again, disregard what they're saying. First of all, you're going to be paying them anyway. So, they're working for you. Think about that.
I 100% agree with what Congresswoman Adams just shared. That's why it is so important to identify that provider. And one of the things that I didn't put in the presentation is we have to know our rights in the American healthcare system. We have rights, and we can say no. We can refuse treatment. We have rights that we have to make sure that all of us are aware of. So you had a right to say to that provider. And that's what I had to do with my mother and my father as a caregiver. I had to be their advocate and make sure that if it was the wrong provider, we can fire the provider and go get another one. And listen, not just fire that provider, fire that entire practice, And that's what we have to do. I want to share one other thing. Thank you for acknowledging my mom. That really warmed my heart. I'm bringing her with me today. We are readers in my household, and my husband gets on me all the time. He said, "You do not need to go to Barnes & Noble another day." It's like every week I'm at Barnes & Noble, but we are readers. My parents were avid readers. My dad made us read. My dad would not, I couldn't ask him for a word. I had to always go to the dictionary. Well, back then we had encyclopedias. So, but I wanted to share 3 books with you all. One is Medical Apartheid by Harriet Washington. I want to make sure that we are understanding. This is a very good digest. The other one is Legacy, a Black physician's reckoning with racism in medicine. And then the other one is Weathering, the extraordinary stress, ordinary life in an unjust society. I meant to have these on the screen, but if you want to take a picture of the ISBN number. And I do want to do just an acknowledgement of Dr. Natalie Hernandez, the Center for Maternal Health Equity at Morehouse School of Medicine, Shanavia Montgomery at Caring, and I just wanted to acknowledge them for the great work they've done, as well as Jamie Dorsey with the Center for Black Women's Wellness. Also want to lift up Heavy Provost, who's with AgData. AgData is an information technology firm that it was once owned by Robert Smith with Vista Equity Partners, but they have been so gracious to us. For the last 5 years, we have space there to how to provide the simulators, provide the trainings, provide the graduations and everything. And so I would be remiss to not acknowledge them for that. Thank you so much.
Okay, and now we have 1, 2, 3, we have 5 more, so we're gonna try to.
Good morning. So midwives, Black midwives delivered most of the babies in the South, everywhere, even poor white people, Black people, and they had ancestral and traditional knowledge. And it was interrupted because of gynecology. They wanted the patients to go to white men. what are we gonna do? Can we incorporate those practices in today's, I guess, practice? Because having a baby is not a medical procedure, it's natural. And how they operate in institutions, it's unnatural. Like, is there any way to combine?
That's a great question. And so several states right now are actually providing for midwives. Several states are doing that. And that's something that we can start advocating for and lobbying for here in North Carolina. But there are several states that recognize midwives, and they are part of the payer network. So that's something that we could definitely do, so that they are a part of it. Because they do have that compassion, and they do have that understanding, just like the doulas do.
Yeah, there's a midwifery organization here. I mean, it is becoming more pronounced. You know, when I had my children, we had only one choice: you go to the hospital. You didn't have birthing centers. You know, never heard of doulas. But let me just say to the gentleman, a few months ago, I met my first male doula. So listen, guys. You know, you all can be engaged in that way as well. I was really, and he's got an organization. I met him. I was giving a lecture in Greensboro, and I was absolutely amazed that men are now getting involved in this, and you should, because it's a family thing, really, when you think about it.
Good morning, y'all are kind of answering my question. Also, good to see you, Alma. I'll probably catch you again in April. I'll be in DC, so I'll try to knock on your door. I can. You usually answer. Thank you. In regards to health literacy, you all are kind of speaking towards, but what steps are being taken to bring awareness to those alternatives like doulas, holistic, like more of the holistic birthing? And on top of that, are you including abortion in your Black maternal health?
Well, in our work, we don't discuss those types of alternatives. We don't discuss that in our work. We are discussing, we probably spend more time on preventing unintended pregnancies. That's the option that we take. How can we have a consequence-aware decision-making? However, we do know that a lot of pregnancies are because of abuse, assault, and maybe rape. We know that there is a high level of sexual assault in the household. And so we are addressing that with bringing awareness to adverse childhood experiences, those experiences that young people experience before the age of 18. And then that abuse and assaults that women and young adults experience. So we do have a new training that we're launching called The Shift, from adolescence to young adulthood, to really talk about those health providers and health literacy. But our organization, we have not addressed abortion in ours. Yeah.
Well, let me just put on the record, abortion is health care. And I continue to say that. But the Black Maternal Health Caucus is a bipartisan, bicameral. And so we're working with people on both sides of the aisle, in both chambers. And so we have to be, or we should be, always in agreement with what we're talking about. But the Black Maternal Health Omnibus Act does not include that. However, our caucus does interact and build relationships and work with many organizations that actually address that. So, but we don't do that in terms of this bill.
You've kind of answered my question. I was going to ask about midwives and also about the doula system.
Ms. Nathalie.
Thank you. One thing that I heard today that is actually just totally depressing me is that the situation is getting worse, that the 80% is not going to be the ceiling. Why in 20 years, which is the time frame that I think you mentioned, is it getting worse?
Well, I tend to think that so many people didn't realize that there was a problem. And a lot of what we have to do is to educate. Knowledge is power, and power is what makes the difference in lives and communities. And so I think organizations that you've heard about today, what we're trying to do at the congressional level, what they're doing at the state level, because the word is getting out now. And it's a little late, but it's getting out now. And people are responding because most people, just as you just said, they can't believe what they hear. Really? This is a problem? I never thought about having an issue when I went into the hospital early that morning to have my son, who's a grown guy now, and he's got children, and his children has children. So that you know, we have one great granddaughter. But the point is, you know, things are changing, but attitudes, we must change attitudes, and particularly in the medical field, because that bias and that racism, you know, sometimes people don't realize they have it, you know, but when you think about what happened with this woman that was on the screen, it's the case. And one of the things that we do in our training, in the Kira Johnson Act, is to address that issue of racism and bias. Because people don't, you know, doctors, they told my daughter had a doctor who said, well, listen, so you're having a pain, well, just go home and lie down on your side. I mean, really? So, she's a black woman, you know, she was, and he probably sighed, just like the nurse did on the screen. But you know, they have attitudes. They think black women are stronger. We're pretty strong, right? You know what I'm saying? We shouldn't have to bear any more pain than anybody else. But there are some medical folks who just believe that, oh, you're black woman, you can handle that, really. But anyway, it's about knowledge, and it's about educating people, and I think that's what we have to continue to do. That's why things have not happened as quickly as they should.
I'm going to just add briefly to what Congresswoman Adams just said, and she hit the nail completely on the head. Some medical schools right now in the United States of America are still teaching that black women can bear more pain than white women. Right now, 2026. That's why we created that Respectful Maternity Care Simulator, to go into these universities and these medical schools and hospitals. Oh, I'm gonna be all right. I'm gonna be all right. Okay. We have to make sure that you all of us, have an understanding of health literacy and how to advocate. So we're going to be doing the Respectful Care Simulator at UNCC in April. Would love to see some of you all there. And we have a gentleman here representing one of the televisions. We're talking about awareness. And we need awareness in our community so that people understand that this is still happening. They're so critical. Thank you.
Okay, it's a great book. Lorenzo.
Thank you both. And of course, in true fashion, you answered my question just ahead of me getting the microphone. But you said you read a lot in your family, and I want to kind of speak to the men here because readers are leaders. And I just had a conversation last night where a family asked me if pregnancy was considered a disability. In my line of work, we work with disability income and those kind of things. And oh yes, I have a question. But that's an important preface to the question, is because listening to her speak about that as men, I wasn't in tune to even thinking about pregnancy being a disability. So is there a structure or a checklist of questions or things that the men should be having conversations at home, right, with our wives and our significant others?
That's a very good question, and yes. So I will say this, at one time on the CDC site, there used to be a Hear Her campaign. They watered it down quite a bit. But we do have a checklist, and I can give you my card, and you can reach back out to me, and we can send that to you. We have a daddy's checklist, a daddy dude checklist that we put together So that, and we pulled some of it from the CDC site, but yes, thank you for asking that.
If you could send that to Steve, he can put it on the website, everybody will know them.
I just wanted to add that because of the work that we're doing in the Congress and most of we have that, our caucus of men and women, but we now have a daddy's caucus.
Yeah.
And so I'm sure they have a website, and you might want to check that out and see what they're doing. And they're doing, that's in response to the Black Maternal Health Caucus. And so they've got a pretty large group of men in the Congress who are working on this issue too. So, yeah.
Thank you for your question. Oh, Gary.
All right. As a man, if you're at home and you're contemplating whether you should do a hospital birth, a home birth, working with the doula, as Mr. Robinson alluded to, what would be some of the probing questions you should be asking as a couple to find out if they have the best equitable care for Black women?
That's a great question. You all are just asking some really wonderful questions here. I might be able to use some of this in developing a program. But you know, you really, when you're interviewing your providers, and we should interview our providers, all of them, cardiologists, urologists, nephrologists, endocrinologists, we got to interview them. Just because somebody gives a referral to go to the doctor, it's a partnership. It's a partnership with your provider. So your question was, what types of questions would you ask, which was similar to what he asked earlier. So if it's all right with you, I'd like to put something together for you. But I don't have, specifically with what you're saying on looking at the doula and the pros and cons, I think the A1 has something. That was the Association of Nurses. A1, I think they have something on their site. But I'll have to look into that because I don't have that information. But I appreciate you, because if you had that question, somebody else does too. So I want to make sure we have something in place.
Oh, I just wanted to say this also. My daughter had a midwife and a doula when she had her baby in Washington, D.C. And one of the things that she really liked about it was that they were associated with the Washington Hospital Center. So that if anything happened, she had the baby off-site, of course, at the center. But she really, really loved that, to have that. And the midwife or the doula, one or the other, would come and visit her the same day. She came home 4 hours after she had the baby. Wow. I know. And they would come and visit her every day for like 2 or 3 days to make sure that everything was okay. So I think, to answer your question, make sure that they have a hospital backup plan, that if anything happens, that, because you never know which way it's going to go.
And it is a personal choice. Just like Christina just shared about her decision to have a natural birth, it's a personal choice.
Good morning. Oh yeah, he rang loud. Good morning. My question is, you mentioned that the stats or the records haven't been kept since 2013, with the last reporting being 2015. We're talking about now 11 years ago. What needs to be done to bring that back so that it's now something on record so that we can get more attention drawn to it? Because it's our people, so evidently the others don't care so much about our results.
Well, that's, I think it starts right here in this Tuesday forum. Those individuals that feel that that is a passion and they really want to be a fierce advocate for that because there's a need, then they have to mobilize. They have to come together. And when I saw that yesterday, it was disturbing to me. And I don't know whether they stopped it because of the numbers, the number of maternal deaths, because I think in a 10 years period, it was like 3,300 or something like that. But just one death is too many, right? So I think that that's something that we ought to look at. And I would be willing to partner with you and collaborate with you in doing so, if that's something you're interested in.
Well, let me add, let's get the omnibus passed. Okay. Just say that. We're gonna file this bill again. We need some advocates to write members of Congress, the senators, the representatives, not just me, the Republicans and the Democrats. Because this is an issue, it's not a red issue for a red state, it's not a blue issue for a blue state, it's a red, white, and blue issue, it's an American issue. It's about American women, it's about Black women. And so in our bill, in our omnibus package, data collection and involvement becomes a big issue because you need that. And you're right, they don't want the data because they don't want to, put the programs in place that would support. You got the data, here's the problem. But that's what we have to do. We can get this bill passed, the whole package. If we got one of the bills out of the package passed, we can get this whole package passed, and it's gonna really help so many people, so many Black women, 80%. This is preventable. So it doesn't have to be like this, but we have to be engaged and involved, and we gotta push these members of Congress to do the right thing for the right reason. This is the right reason. They got people in their districts, I don't care who they are, who look like us in this room. And so we need to keep reminding people of that. And we're talking about babies. Our babies can't wait, our moms can't wait, and we shouldn't have to. We should not be dying more as Black women than 4 times the rate of white women. Why is that? That should not be. Some of these things that we have prepared in the omnibus package will actually take care of that. So we've got about $200 million added to the program to really help. And I've worked with Karen a lot. I know Shadelia, and they're doing some great work there. But that's what I would say. We can advocate in our homes, but you've got to advocate to the people who shape public policy. That's people like me, but I need some help, is all I'm saying. Okay, I appreciate it.
Can you send us that information about, about
The omnibus? Okay.
So we just heard Congresswoman Adams, and see, you all saw what we were able to do, right? You all have been in here and you saw what we were able to do. And it was just one person that said, let's do this. And then that one person said, let's get 2 or 3 more people together. And then we got 5 people. And it wasn't a lot of us, but we were able to do it. Now, Congresswoman Adams is right here. She is our Congresswoman. And she's saying right now, I need your help in order to do this for all of us. She didn't say it for her. She said for all of us. So she said she's not having any more babies. But she's got grandbabies that's going to be having babies. So what I would like to do right now is another call to action. You heard me close with a call. How many will stand with me to support Congresswoman Adams so that we can get something done? In North Carolina, okay, it's happening across the country. There's some hot spots in the country. When she was just talking a few minutes ago, there's a neighboring state who has had an F rating forever, and their hospitals will not do anything for maternal mortality. They will not tell you how many women have died. But I know my first contract with them, my husband and I went down to, and let me honor my husband, Joel Glass. Thank you, Joel. God bless you. Thank you. Yes. He allows me to do this work, and I appreciate him so much. But what I want to say is this hospital, my first job with this HRSA project, my first day, we went down there, and it was right at the cusp of COVID. We got a call that a woman had died. And let me tell you what happened. She went to the hospital, she delivered her baby, she was working at Burger King, and so they let her leave the hospital. Her blood pressure was 210 over 120. That was her blood pressure when she did. I saw the death report. She went to Burger King because she needed to work. You heard Congresswoman Adams talking about social determinants of health. She had to work. She went to the hospital, went to work, collapsed, and died. That hospital has never acknowledged that that woman was at their hospital, that she delivered from that hospital, and that she was discharged with that. When they do the state of the hospital, the report, the state health improvement plan, and all of those things that hospitals and county governments do, they've never listed maternal health, and this is one of our neighboring states. So what's happening is those people in that neighboring state are coming over to North Carolina to have their babies, but they don't have that care. So they're going back over to that state, and they're having tragic outcomes. So let's stand with Congresswoman Adams. Let's support the work that she's doing for us. And I promise you, I did not know she was going to be here today.
Well, thank you for advocating for what we're advocating for. It's important. And again, this is preventable. We can do something about it. I do have a 10:30 that I've got to get back and get on a Zoom. But we'll send the information on the mom list. We're getting ready to reintroduce it in about a week. On the Senate side, Senator Cory Booker is carrying the bill for us. So when you have the bills, when you have these legislative initiatives, and you can take them through both chambers, you have a really good chance of getting it passed. And Martha, I'm glad to see Martha Alexander back there. We did a lot of work together in the North Carolina House. But let me just close by saying knowledge is power. And power is what makes the difference in lives and communities. And the first thing you have to understand about power and how to get it, you don't ask somebody how to get it. You take it. And once you take it, you use it. So let's do that. Thank you. God bless.
Thank you so much. We still have a couple of questions for Ms. Glass.
Yes.
Okay.
And can I introduce my
Hi, thank you so much.
Let me just introduce my staffer back there. He comes all the time, Lawrence Brinson. So if you need to reach me, reach out to Lawrence. He's here, I think, at every one of your Tuesday morning forums. Yeah, so he is our one of our representatives who does casework, but he also does community work as well.
I do. Thank you so much. I'm a mom of 4 and almost passed away with one of my children almost 20 years ago. But quick question, you mentioned the health simulator at UNCC. So for community leaders who are boots to the ground, talking to the families in the schools and all that, what sort of information can I get so that I can pass out so we can get more advocacy and awareness of that?
I appreciate you so much. That is what we are striving for. We want to have a session on a Saturday. Lately, we've been having them on Thursdays, 3 sessions on a day. We start at 10, another one at 2, and another one at 6. So we're going to do one on Saturday. So if after the session, if you don't mind, I would love to get your card and your information. I'd love to share. And then I would like to collaborate with you and get as many people as we can. Okay. Also, we have a heart training. I don't know if you heard about that. You get a completion bonus with the heart training. So heart is health literacy and patient advocacy. And we do provide a $50 completion bonus for those who complete that training.
Thank you for that.
I think I have the last question. So one of the quotes I navigate the world by is, even the abolitionists work hard. A reflection of how lofty systems are. And I know the sentiment of the attitude given by health care professionals and staff during times of childbirth. And my question is, I feel like their attitudes would be a reflection of greater systemic pressures, and I wanted to know what can we do to regulate hospitals, because I know how mechanized the childbirth process felt, like an assembly line. So I think the experience is a result of this mechanized system. Could that be regulated with our healthcare professionals or with our healthcare systems in North Carolina?
You know, you all have had some great questions. That's one of the things that we have been working on. We wanted to start it with maternal mental health to make sure that when the mom delivered, by the time that someone would check on them during that postpartum period where there's a high level of postpartum depression, not just baby blues. But because of the systemic problems that we have, in fact, we have a strategy session coming up in April. We'd love to invite anyone to it. The strategy session is like a community listening session where we're going to be asking you, what do you think we can do with the hospital systems? And get the hospital systems to the table. So I will share this with the Respectful Care Simulator. We've tried to get 2 of the hospital systems here to the table, not just with the residents, but with the actual providers. They have had the residents come, which is great, because those are the emerging physicians, right? And we hope that they stay in Charlotte, but they may go other places after they complete their residency. But for the hospital providers, those that are there to come, we've had a little bit of a challenge. And so that's a systemic issue that we're dealing with. They would rather do something internally themselves than to have someone come in and possibly enlighten them on some implicit or explicit biases.
Okay, just one last thing before we close out for the men. Men, traditionally, years ago, men were very involved in childbirth. Because I know that my mother had her first 2 children at home because her mother was a midwife. So she delivered at home. And my father talks about all the preparation he had to make for the delivery of the children. So that men, I think when we went to the hospital, we removed men from the process.
And Kelly is here. There were a couple of people that had questions about the daddies, like a daddy do checklist, which we have. So Kelly, you mind standing up, please? Kelly Little, is Strickland Urban Families.
Okay, I got you. Okay, one other thing. Oh, I'm sorry. Go ahead. No, I was just going to say, we are going to have announcements, but I do want to thank those of you who are making donations for our coffee. We always have a donation box back there for the coffee that we provide every week. So thank you so much for the donations. Okay, go ahead.
First of all, Danette, you've done a great job because I was watching you online before I even got here. Great presentation. And the other thing is just making sure we know what's in our community. Not only do I run a fatherhood program that creates spaces for men to focus on helping women through all 4 trimesters of the pregnancy, because most doulas deal directly with the mother. But this is not a mother process by herself. And when men are actively involved, attending all the visits, making sure we're aware of all the different issues and challenges that they may face, like eclampsia, preeclampsia, postpartum, those things are real. And men can actually get postpartum as well. And so our awareness around those things are the things that allow us to be able to advocate for our mothers, secure the information that allows us to interrogate these hospitals to make sure that our women's issues are not only being heard, but they are being respected. And I heard you talk about the lady at Burger King who passed, but you had a midwife in South Carolina who passed, who did the work and wasn't treated the way she should have been treated. So, just so you know, Urban Institute for Strengthening Families, I am a doula, but I do the doula process to be able to create a space to support men so that they know how to support their girlfriend, their significant other, or their wife, so that we produce healthy babies. Yes. And I also mobilized, and I was in D.C. when that Omnibus Act and the Dads Matter Act with Charles Johnson, who you watched the video of him earlier. So you got somebody here in Charlotte that's on the ground and that's committed his life after committing my life to the military to black women and all women, but we gotta reduce these numbers significantly.
Thank you so much.
Oh yeah, yes ma'am.
Thank you so much. Okay, we're gonna take some announcements now. You can raise your hand if you have an announcement. Okay, we got Commissioner.
Enjoyed the conversation. Perhaps you can get Dr. Kimberly Scott from Mecklenburg County Public Health to come talk about specific data on black infant mortality as well as black maternal mortality right here in Mecklenburg County. I just wanted to say thank y'all for the forum and also thank you for your support last Tuesday. Thank you very much.
Okay, I think we had some more announcements. Right here.
Good morning. On March 21st at 1 p.m., Jordan Lopez will be sponsoring the Town Hall in East Charlotte. The Four Seasons Homeowners Association will be sponsoring that event. So if you do live in District 112, please come out and hear from our state representative, Jordan Lopez. Thank you.
Okay.
I'd like to announce that there's a program here in Charlotte funded by the city, Learn to Earn. Persons can receive a free laptop upon completion of 14 hours of computer training. And that training is from basic to AI, cybersecurity, Gemini, Canva, just the whole ball of wax. We do not want to get too far behind. The training is free and the laptop. You don't want to have 200 at the end of the year in the office. So contact me if you have questions.
Thank you. Thank you. Any other announcements?
Hi, I'm Jataya from Sister Magazine. Ms. Danette, thank you for your work in the community and on Black maternal health crisis. I just want to say that this March Women's History Month, we have our Black Women's History, The Last Shall Be First edition. It highlights over 200 Black history icons, some that we don't know, some that we do. And so I'll be bringing copies next time, but if you would like to see the version, you can visit www.sistermagazine.com.
Thank you. Any other announcements? Oh, yes, right here. The lady in red.
Hi everyone, I'm Sade with Quality Comprehensive Healthcare Center. So we provided the donuts this morning.
Thank you.
Shout out to Quality.
Y'all save me one, I want one.
Thank you.
And the coffee. I'm the Community Engagement Director, and for Women's History Month, we are doing a menstrual drive at our organization. So we are collecting pads, wipes, menstrual cups for unhoused women, and we will be giving them out because we have a lot of clients who do come in that are unhoused. So if you would like to donate, it's 3607 Betty's Ford Road. And we're collecting them through the end of the month. And we'll also have a community cleanup on April 22nd, Earth Day, and we'll be at QC Family Tree. That'll be the hub, and we're cleaning up the West Corridor during that time. And we'll have a STI awareness event where we'll be doing free HIV and STI testing on April 17th at our location as well. Thank you.
Okay, and if anyone would like to donate those feminine hygiene products, if you bring them here next week, I'll be happy to take them over there because I live not far from you.
Yes, ma'am, and I'll be here. I'll come every
Oh,
week.
you come, okay, thank you. Ken.
All diabetics, please raise your hand.
What?
Diabetic, if you're diabetic, just raise your hand. Is this me and Jackie? Okay, well, that should be pretty easy. Bring us some diabetic donuts next week.
Who's the diabetic donut? That's an oxymoron.
Okay, let me explain one thing before we
Made
go.
from steak.
One thing before we go, I do want to tell you about next week. Next week, we're going to be talking about women and long-term care insurance. We all know that we women outlive our men for the most part. So we need to, Ken said we worried them to death. That's not true. You all just don't follow our direction. But anyway, we're gonna have a discussion about that, with an expert, okay? So, let's give Danette a big hand.
Dr. Thomas, play us out.